Good morning. My name is Faith. I'm a nursing student at Northwest Arkansas Community College, and I'm here to perform a physical assessment. Can you tell me your name and your date of birth?
Catherine Ramirez, 9/14/53,
Okay, where are we at right now?
in Weck Hospital.
And what is the month and the year today?
September, and it's Tuesday.
And what brought you in today?
I had a fall.
Okay. Then I would do my environmental sweep. So I would, if the client was on oxygen, I would assess the flow rate, that it was on oxygen and not medical air, and then it had the appropriate delivery device. I'd also make sure there was no kinking. Then I would assess the IV site. I would look for any redness, erythema, swelling, that the dressing was intact, that there was no bleeding at the site. I would ensure that if it was connected to an IV, that I had the right fluid, that the pump was going at the appropriate rate. Then I would check if the client had a Foley catheter. I would ensure that it wasn't kinked, that it was on a non-movable part of the bed, and I would assess the color, clarity, and amount of fluid that the patient had. Then I would assess my client. Are you in a comfortable position right now?
Yes.
Are you in any pain?
Yes.
On a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you could imagine, what number would you say it is?
4.
It's a 4. When did this pain start?
2 days ago.
2 days ago. And where exactly are you
My
hurting?
left knee.
Your left knee. And is it an intermittent pain? Does it kind of come and go, or is it constant?
It comes and goes.
Okay. And is it a sharp pain, an achy pain, a dull pain,
Aching.
an aching pain? What makes it worse?
When I have to walk on it or
Okay.
try to bend down.
And is there anything that makes it better?
Rest. And if I elevate it,
And what treatment have you tried for it?
I put some ice on it and I took some ibuprofen.
Okay. Then I would look for any obvious signs of distress, cardiac, respiratory, pain, or if they have any kind of anxiety or depression. I would look from head to toe for any physical deformities. Are they symmetrical from head to toe? Does the client appear to be the stated age? Is there any language barrier? Is the client hard of hearing? Are they having any trouble understanding me? Am I having any trouble understanding them? Is their hygiene appropriate? Are there any obvious body odors? Are they wearing appropriate clothing for the situation? And then throughout the assessment, I would be assessing their skin. So at this point, I'm going to raise the bed to a comfortable working height for me.
Could I have my head up just a little, please?
Of course.
Oh, that's okay.
And then I would put the rail down on this side. Okay, can you remove your glasses? I would turn out the light. Look right here at my nose. I'm looking for the pupils to be equal, round, reactive to light. Her pupils are about 4 millimeters. Go ahead and follow this pen in, and then there is good accommodation. You can put your glasses back on if you would like. Turn the light back on. I would look for any redness or drainage, and then I would put the rail down on this side. Okay, can you remove your glasses? I would turn out the light. Look right here at my nose. I'm looking for the pupils to be equal, round, reactive to light. Her pupils are about 4 millimeters. Go ahead and follow this pen in, and then there is good accommodation. You can put your glasses back on if you would like. Turn the light back on. I would look for any redness or drainage from the eyes. Then I'm going to examine client's ears, look for any redness or drainage. Any redness or drainage. Look at their nares for any kind of breakdown, redness. Go ahead and open your mouth and say ah for me. Any redness or drainage there. Then I would check their carotid pulse, one at a time, for rate, rhythm, and amplitude. Then I would check radial pulses for rate, rhythm, and amplitude, and making sure they're equal bilaterally. Have the client squeeze my fingers, and then I would check capillary refill to ensure that they're less than 3 seconds. Move down to the lower extremities. I would check the posterior tibial pulses for rate, rhythm, and amplitude bilaterally. Would check the dorsalis pedis pulses for rate, rhythm, and amplitude bilaterally. Have the client wiggle their toes. Check capillary refill, less than 3. Push down like you're pushing on a gas pedal. Pull up. And then I would perform hand hygiene. I would clean my stethoscope. For the purposes of this demonstration, I'm not going to be listening on the skin, but you would want to listen on the skin. Help my client to sit up a little bit more. We're going to sit up a little bit more if that's okay with you. Then I was listening at the second intercostal space on the right side, right next to the sternal border for the aortic. I'd listen for the rhythm and the rate. This is S2. Then I'd listen to pulmonic, second intercostal space. Then Erb's point. Then I'd listen to the tricuspid. Listening for any murmurs or adventitious sounds. The tricuspid and the right mitral are S1. Then I would listen to the apical pulse for a full minute for regularity and rate. Spend a minute, rate is about 70. Then I would listen to the lungs. I'm listening for a full inspiration and expiration using the ladder technique in 6 different spots. Listening for any adventitious sounds like rales, rhonchi, wheezes. Then I would assist my client to sit up, listening in 6 different spots, not listening over their scapula. Would listen in 6 different spots, avoiding their scapula, using the ladder technique. Listening a full inspiration and expiration. As my client is sitting up, I'm going to be assessing their back for any signs of breakdown. Okay, you can lean on back. I'm going to have you lay flat for me now. When was your last bowel movement?
This morning,
And what did it look like?
it was brown and soft,
Okay, when's the last time you urinated?
right after lunch.
Can you describe it for me?
It was yellow.
Yellow, an
I take
adequate amount?
vitamins. I take B vitamins.
Okay. Then I would remove any clothing. I would inspect the abdomen for any bulging, protrusions, any bruising, ensuring that it's symmetrical. Then I would assess vowel sounds in 4 quadrants. I'm going to palpate the abdomen using a rocking motion. Please let me know if this hurts at all. I'm observing my client for any signs of pain or distress. All right. Then I would raise the rail, assist my client into a comfortable position. Let me know when your head's high enough.
That's good.
I would lower the rail. As my client got up, lower the bed, raise the rail. If my client had to use the restroom, I would assess their gait. Got the rail up, the bed's down, I'd hand the client their call light. Is there anything else I can do for you before I
No, ma'am.
leave?
Thank you, though.
Okay, that is the end of the physical assessment rubric.